nurse. Do you remember me?
I think I don't remember you.
Don't? All right. Well, I was with you one of the first days you came, so it's been a while.
Oh, okay.
Okay. All right. Well, I noticed on your chart that you're going to be starting a new medication. Have they talked to you at all about that?
All they told me was that I was going to be starting a new one. I don't remember what they said it was called or what it was for or anything.
All right, so that's what I'm here for. I'm going to talk to you about your medication today. So I brought this sheet with me, and I'm going to give it to you at the end, but I'm going to kind of use it as a reference, and that way you can see what I'm talking about as we go through. Sound good?
Sounds great.
All right, so what we're going to be giving you is Bumex, and it's for your heart failure.
Okay.
So each day, once a day, you're going to get 1 milliliter through your IV. You still have your IV in, right?
I do.
All right.
It's right here.
There it is. Okay.
Other nurse did such a good job putting it in.
Good. I'm glad to hear that. All right. So they'll typically give it over 1 to 2 minutes, but they can give it over 5 minutes if they want. They can dilute it if they want in D5W or 0.9% normal saline, just for if you were curious. We recommend that you eat a diet high in potassium, okay?
What would I eat that is high in potassium?
That's a great question, Megan. So you're going to have bananas, avocados, spinach, sweet potatoes, white beans, or yogurt.
What if I don't like any of that?
You don't like any of those?
I don't like any of those things, and I'm allergic to bananas.
And you're allergic to bananas. Well, there's also potassium pills that we could give you if that is something that you'd be willing to
I think that would work better.
Okay, good. So do you have any like allergies or anything, or take other medications?
No, I do not.
No? Okay, so one of the major things with taking this medication is you have to look for a rash. So if you see any signs and symptoms of a rash, you need to report that immediately to your doctor.
Okay.
Okay. So some of the common side effects that you'll see with this medication are dizziness, headache, hypotension, which is your low blood pressure, diarrhea, dry mouth, nausea and vomiting, and excessive urination.
That sounds like a lot of bad side effects.
Oh, some of them aren't.
It doesn't sound like it's a very safe drug for me.
Oh.
Are you sure it's okay?
Yes, I will reassure you that it'll be all right. We'll take your blood pressure and your pulse before we give it to you to make sure those are within the normal ranges.
Okay.
And if there's any concerns with that at all, we will hold the medication and notify your doctor before we give that to you.
Okay.
So moving on to some of the adverse effects, which are the bad things that we don't want to happen when you take this medication. Some of those are Stevens-Johnson syndrome, toxic epidermal neurolysis, dehydration, hypovolemia, hyponatremia, hypomagnesia, hypocholeremia, hypokalemia, and metabolic alkalosis. Do you understand all those?
I do not. I didn't. That just sounds like a completely foreign language to me.
I completely understand. So the main thing with those is, like I said earlier, we want you to tell us about your rash. If you have any rash symptoms, you need to tell the doctor immediately, or your nurse, and they'll tell your doctor, as well as eat those, have a diet high in potassium, but you said you don't like that, so we might recommend taking a potassium pill. So
Okay.
I'll also talk to your doctor about that when we're finished here. So before we give you this medication, I told you we'll assess your blood pressure and your pulse before we give it to you.
Mm-hmm.
Also, if you have any ringing in the ears or hearing loss, you should report that to your nurse or your doctor.
Okay.
You said you didn't have any allergies, right?
Nope.
No?
I
Okay.
am perfectly healthy other than my heart failure.
Good. I'm glad to hear that. We're going to get your heart failure under control, though. So
Thank you.
It'll be looking good. And also throughout the day, we're going to assess your weight daily, your INO, so what you take in and what you excrete out, as well as your edema, which is any swelling, lung sounds, your skin turgor, so we'll see like how taut your skin is, and your mucous membranes, so we'll see if they're wet, pink, and moist, stuff like that.
Okay.
So what I recommend you do is that you can weigh yourself daily. I want you to do it at the same time, every day, on the same scale.
Okay.
Okay? So do you have is there a scale in this room that you use?
No, I think they usually bring one in.
They bring one in for you. Okay, so I'll tell one of the other nurses too that we need to get a scale and we'll put your name on it. That way it's the same scale every time, you know, and we'll put it in the same place in the room, and we'll probably just leave it in here. That way we don't have to worry about having a different scale.
Okay.
Okay? So then I want you to, everything that you eat, I want you to write that in a little booklet for me. Alright? So just everything that you consume. Okay?
Okay.
That way we can keep track of what you take in.
Okay. I hope I
Alright?
can remember to do all of that.
Yeah, well, the nurses will be here too, so we'll help you out with it, and we'll put it in your chart also.
Okay.
All right? So we'll kind of compare. We get what we get, and then we'll look at your booklet and see what you got, and we'll compare the two of them.
Okay.
Sounds
that sounds good.
Okay, so same with the daily weight. When you weigh yourself, just go ahead and write it down. There'll probably be a nurse in the room when you do it, so make sure we get the same thing every single day.
Okay.
Do you have any questions?
I don't think so.
You don't think so? Okay, well, I'm going to give this to you, and you can keep it with you.
I do have one question.
Okay.
I'm just taking this while I'm here in the hospital, right? I don't have to take this at home.
Yes.
Or come in after I leave to take it.
No, that should not be a problem. We will, we're going to try to keep you here as long as we can and give that medication to you until everything is under control. And once that's under control, then we'll look about discharging you so that you don't have to go home on this medication.
Okay.
All right?
I think that sounds good.
Okay. Well, you have a good day, Megan.
Thank you.
Uh-huh.
Come in.
Hi, Megan.
Hi.
It's Dr. Tomlinson.
Sorry.
I promise. It's going to help with your heart failure, okay?
Okay, if you say so. What was the first one?